Thank you for joining us for today's webinar on the Communications Toolkit for Child, Family, and Community Wellbeing. This webinar is sponsored by Casey Family Programs in partnership with Implematics, the California Training Institute, and CDSS. We have a quick and impactful 30 minutes together, so before we continue, I'd like to turn your attention to several announcements in the chat. Our presenters this morning are the developers of the Communications Toolkit, Lori Cappy and Beth Kunstler. Lori is the president and founder, and Beth is a senior consultant at IE Communications. Together, they bring significant experience and insight to communications and community engagement strategy. Beth and Lori, we appreciate the opportunity to learn more about the toolkit with you today.
Good morning, everybody. I'd just like to share with you the overview of what we're hoping to accomplish in our impactful 30 minutes, as was just introduced. There's a toolkit that's been developed. There's a link in the chat. For those of you who have not looked at it yet, I encourage you to click on it. But what we're going to do today is walk you through some of the framing and messaging and materials and methods that are outlined in these 9 pages. There's 9 pages and 6 linked tools. And my goal for today is that you leave this session and actually click on it and work through it. And the purpose of this toolkit is to support you in your communications planning and your implementation, with the main target audience and goal here of engaging the public and private partners and the community, those and particularly those with lived expertise. So in terms of the learning objectives, what I'd like you to leave today's session with is how you can share your county's vision for prevention and well-being with both your current and potential partners that you're working with on your county prevention plans. But most importantly for me is when you get to the actual implementation as well. I'm going to just briefly go over some of the nuts and bolts of communications for both planning and implementation, and a few tips on how you can take some of these messages and materials for your own counties and your own audiences. Next slide, please. So we're going to get started with this toolkit walkthrough, but before we do this, I want to share with you a very important anchor to this entire discussion. So if you leave today with nothing more than remembering this infographic, I will feel like I succeeded. So, you know, if you look at my bio, I've been doing this work for maybe 3+ decades. And, you know, it's just so exciting for me personally, as somebody who's been a child welfare advocate, to have the stars aligned where we are truly, both by public investment and public opinion, getting to a point where our vision is kind of starting to align. What we want for our families, for our children, and for our community is well-being. We want to reimagine California centered on equity and social justice. And to get there, and this infographic, I just want to say, was developed over almost a 2-year period with extensive focus groups, extensive interviews, extensive discussions to collect what we thought would be a vision that we can all adopt and adapt. A vision where we have housing stability and financial stability and quality education, physical and mental health, social supports, and safe neighborhoods. So beyond the details of our comprehensive prevention planning, I'd like you to all keep kind of firmly or somewhere this as your North Star. So now I'd like you, Beth, if you could please take us to page 1 of the toolkit. So, like I said, the toolkit's 9 pages, and there's a lot of hyperlinks. And so it's a little funny, jumping back and forth into the hyperlinks. I'll show you a few of them, but not all of them. So, at your leisure, take the time to look at some of the tools that we provided for you. When I got the assignment to create this, one of the things that I said is I want to do a toolkit where we're not necessarily teaching you to fish, but we're giving you the fish. So in this toolkit, we have a lot of what I would call plug and play. I'm mixing my metaphors, but you get what I'm saying. Things that you can take and just adapt for yourself. So you don't need to spend 3 decades working in communications like I did. Just take these tools and adapt them. So the other thing I wanted to point out is that this isn't the first rodeo here. There have been countywide planning initiatives, and some of you maybe have been involved with them over time, like Proposition 10, MHSA, more recently, of course, AB 2083. And I know Richard Connect yesterday did a good overview of some of the system of care work that's going on. So this isn't the first time child welfare has reached out to community or other public partners like behavioral health have reached out to community. So a lot of what I have here is also, learning from those experiences, as well as, folks who are definitely engaged and involved right now. So next, and on the right here, you'll see, I'm sorry, Beth, go back up a little bit. This is just a table of contents. So in here, we, I'm fond of alliteration. So we've got messages, materials, and methods, my 3 M's, as well as media. And then I have my T's, my tactics and timing and tips. So that's just a little clue to how to look at this toolkit. So the next page, please. So the overall goal, the for what, so what, like, why are we doing this? We're doing this because a communications plan is pretty essential if you want to engage some of the multi-system stakeholders in both your planning as well as in your implementation. And one comment I'm going to make a couple of times is you want to have your public system partners as well as your community members help you set the table. You're not necessarily inviting them to your table. And that's a different kind of frame, which means that you need to be very conscious of how you're messaging your invite. Because engagement with these stakeholders, particularly those with lived expertise, this isn't just my opinion. This is like decades of reflection have shown that if you involve the people, if you do policy making with proximity, if you bring in the folks that are going to implement as well as receive the supports and services, you need to have them help you set the table and help you design and figure out how to get to that wonderful vision we have at the beginning. So going down a little bit, who is our target audiences? So that's the for what. The target audiences are your agency leadership, your system partners, the judiciary. I want to point out that they hold a lot of power. And I know in Richard Connects, I don't know how many of you were at that webinar yesterday, but he made a big point of that. And I thought that was very useful. Your tribal leadership and members, your CBOs and your advocacy and your community members. And if you do it all right, what are you going to see as anticipated outcomes? You're going to see your agency leadership and staff, using these talking points. You're going to see your public system partners also adapting these talking points and spreading the word to their networks. You're going to see much more engagement of the target audiences, and you're going to increase the understanding of this long-term vision, that we're not just talking about, getting from point A to point B when you send your plans to the state, but we're talking about getting to that vision, which may be and will likely be many years of work. So what messages do we need? So I want to just make a few notes on messaging. Basically, this is a little communications 101, but you need to reach both hearts and minds when you use your communications messaging. So, and to do that, you need to really concentrate on using simple data and quotes or stories. Um, you know, sometimes we talk about, the crisis in that we're experiencing, and I also want to say that you don't want to be too crisis oriented to sort of compel people. You want to make it into sort of bite-sized data. This is what it looks like in our county. Here's a quote from a child, and here's what you can do. So just make sure you think about things that are solvable. And this is just a quick note that also came based on talking to a lot of folks in child welfare in particular. They understand that there's a history and there's some skepticism when somebody from child welfare says, can you come, help us set this table? There's some baggage there. So what to counter or to help lift, or I don't know what the metaphor is now, to put that baggage into baggage claim. You want to make the case to why this is going to be different, and use accessible language and frame your, again, I'm saying this quite a bit, and if there's anything one little tip I want you to take out of this is think about asking them to come, instead of saying come to our table, come to our meeting, help them to set the table. And that might mean that you're going out into the community, going to community meetings that are happening versus saying, asking people to come to your offices. So the goal is for folks to feel actually included. Okay, keep going now, thank you. So now we've provided for you some talking points. As you see here, we have little things in yellow highlight. And not that you have to be robots and just repeat these things. So obviously just adapt them. But this is sort of your talking points, taking people from, what your, who you are and what this opportunity is. We've got unprecedented new resources and policies. And what do we want to do? We want to realize this vision. And remember that infographic. And then go back to your data. One thing we all can agree on is we can do better. We've got 34% of the children in our county being involved in some level of the child welfare system or touching the child welfare system. We can do better than that. That this is actually a moral and a fiscal imperative that we can do better. That this isn't going to be done alone by child welfare and probation. That getting to that vision, as we talked about, housing, financial security, education, et cetera, clearly means that we need all folks involved. We need housing, financial, quality education, et cetera. But to get there, how are we going to do it? Well, we need your voice, your perspective, and your experiences. And then in yellow is like the call to action. What are you going to ask them to do? Are you going to ask them to come to your meeting, to fill out a survey, to create their own meeting? Because the plan we co-create now is going to be an ongoing thing of implementation in 2023 and beyond. And just at the bottom, I have just a quick note, because the words equity and social justice are really important to all of our thinking about all of the work that we're doing going forward. So I just gave a few bullet points here for you to just kind of give a little bit more definition to why we're using those words, because if all our policies, programs, and resources should be centered on equity, social justice, and respect for tribal sovereignty. So now going down to what are we giving you, my M's? We're giving you materials and methods. So one is our 1-minute message or elevator pitch. You've probably heard that phrase, elevator pitch, but just think of it like, who's in the elevator with you? How much time do you have in that elevator? So so these are just a few comments of a few examples of your elevator pitch. All the children deserve to live and thrive in safe, healthy communities. We've got this once in a generation opportunity. you've got a role to play. And if you are in my elevator and you happen to be a preschool teacher, you know, you can insert something that would make sense to them. So then the methods or how to use, like this, what I just said, actually, so keep going. I gave the same example. So the next page is the infographics. And I'm really, we did a couple of versions of this infographic. And the first version of the infographic, if you could pull that up, thank you, Beth, is you sort of like the before and after. So, and we also created a version of this, you don't have to pull it up, that's a blank canvas. So this is something that you could actually use in a community meeting. You could blow it up and put it on the wall and have it blank and ask people to come up and say, what's their experience with housing? And what's your experience with financial stability? What's your experience with quality education? And we kind of tried to phrase these, you know, in like a first person quote. And then what would you like it to be? And this will get people to think through the vision that we talked about, the vision of well-being. Okay, you can pop out of this now, Beth. Thank you. So that's what I wanted to show you, that you can edit that infographic and use that blank canvas worksheet. I'm not going to show you the well-being sunrise again because we started with that. And then showing you that we've given you that editable version. So now what's another method that you reach out to your target audiences? You know, these days, a very common method is using a presentation slide deck, a PowerPoint slide deck. So we've given you a template, so you don't have to reinvent it. You can tailor it if you'd like, but we've taken all of our key messages and put them into a PowerPoint so that you can insert your key stats and demographics for each of these foundations of community health, which are sometimes called social determinants or social drivers of health. So particularly those from the public health community are probably familiar with those phrases, and it's coming into more and more into child welfare as well. And talk to them about how we're co-creating the roadmap, et cetera. So this is a nice deck that you can use and adapt. Okay, can you come out of it again, Beth? Thank you. The other tool that we've given, and you don't need to hyperlink to this one at this point, but is a one-pager fact sheet. So another method that people use, and so this is a good tool for you for a material for that, is if you're meeting with, you know, another CBO, or you're meeting with a county board of supervisor or somebody else in your community, and you just want to be able to hand them real quick fact sheet to make the case of why we're doing this comprehensive prevention planning and what we're doing to realize this vision. And so I do know, because Beth and I supported the development of the data playbook that was presented to you by, presented to some of you, and is another tool that you can access. The data playbook has lots of good tips for how you can populate these fact sheets. So please use that to help populate these fact sheets. The other thing is, and this is another communications tip, is, you know, it's not a one-off. So, you know, it's fine for you to, you know, 15 people came to our planning meeting, but get back to them and keep them posted and keep them engaged. So how do you do that? By getting maybe a promise in progress e-newsletter. So again, we've given you some sample newsletter copy, adapt it as you want. This is a real easy way. You can then send it to your network, send it to everybody that came to your planning meeting, collect your database, keep people engaged and informed. So now I'm going to turn it over to Beth, who helped adapt many of these key messages to another frequently used method, which is social media.
Great, thanks, Lori. Oh. Thank you, Lori. Thanks, everybody. Yeah, Lori and I were actually quite excited as we were doing our focus groups with stakeholders to develop the toolkit and all of these materials. We were pleased to hear that many folks are fairly robust on social media platforms. And so we dug in and we used the infographic, the Reimagining infographic, to create a set of templates for social media across Twitter, Facebook, Instagram, and LinkedIn. So you can choose whichever works for you. The great thing about these templates is that not only can you use them for tweeting and posting to reach a larger audience, as your partners can retweet and repost, but like all of these tools, you can take them and create templates to hand off to your partners to be using on their own. So they can take this whole template of social media with all of the draft posts, with all of the social media design cards already created, and start using it in their own social media spaces, so that you're empowering them as well to continue to broaden the well-being system, our network. So, and all we have here, again, is all the social media design cards, drafted tweets and posts, and you can complete these with your own language and your own statistics.
Thanks, Beth. Another way that we reach some of our target audiences is through opinion editorials. I mean, it's always terrific if you get local print or press or radio to actually interview you or do the reporting. But as we know, as all journalism has shrunk dramatically, it makes much more sense these days to create your own, basically you're creating your own press release and sending it out with your opinion. So this is an example of an opinion editorial. You should always think about who might be the signatory, because the messenger matters. So it's very nice to have maybe somebody who everybody recognizes their name, somebody notable and quotable in the community, send it out. This is something that also could be translated into multiple languages so that you can reach other constituencies. But this is the opinion editorial, just kind of gives the who, what, where, when, why, and a call to action. So my last page of my toolkit here is what are the tactics and timing. So remember my 3 M's: messages, materials, methods, and now it's tactics, tools, and timing. I've shown you the tools. So now let's think about how we would put this together as a plan. So you think about your target audiences. What's the best way to reach them? You know, is it an op-ed? Is that the best way to reach them? Is it monthly reports? Is it emails? Is it social media? And then consider, of course, your timing, my other T. You know, so you want to then put onto the calendar, you know, 2 weeks before XYZ meeting, I'm going to send out an invitation. 3 days before, I'm going to send some social media reminders. I'm going to post it on Facebook. So, you know, this is where you're building in your timing and your tactics. And my final tip, and this is a plea, is I know in the registration, people told me that you listed, do you have experience? Many of you have, you know, are complete virgins in communications. Some of you are quite experienced, but one thing I know is kind of true across all counties is you don't necessarily have somebody designated that this is their job description. So if you could get somebody to have this part of their job description, or a communications professional to take on this role of pulling all these great tools together, adapting some of the messages, creating the fact sheets, creating the plan, getting the database together. If you have somebody who this is in their job description, I think you're going to see way better results. So thank you very much. I haven't been multitasking, so I don't know if there are any, we've got 5 minutes. If there are any questions that have come in that we could answer now, or any comments that we can answer now. Otherwise, I just want to point out 2 things. One is, if the questions aren't answered today, you know, Beth and I are happy to, after the fact, respond to some of them, and think through what might be best ways to provide support, peer support you might be able to do yourselves. If one county has translated something into Spanish, share it with the other counties. So think of yourselves as a community that's all engaged in reaching this vision of child, family, and community well-being, not only for your counties, but for the state as a whole, and not only for the state, but for the country. Okay, thank you very much.
Thank you so much, Lori and Beth. As Lori just said, our Q&A is open and we have a few moments. So if you have any questions at all about the toolkit, how to use the tools technically, or how to use them with your community partners, this is a great time to ask some questions of Lori and Beth. We'd love to see some questions. In addition, if you are already using this toolkit or are thinking about ways with your prevention planning team to use this toolkit and would like to share in the chat, we have a few minutes. And I think we'd love to see some of the things that counties are working on. And so we will keep this open a couple of minutes. If you do need to go, we will be dropping a survey in the chat. Our work is driven very strongly by your feedback, so we would love a few comments on today's webinar for our prevention planning work. In addition, there is a certificate of attendance at the end of that survey. Let's see. Lori and Beth, can you speak to the shift from FFPSA to FFPS? This is more of an internal communication question. So I don't know if this is Lori and Beth or maybe Dana Blackwell. But I think this is more about the shift in communication for internal staff from thinking about the federal FFPSA to California's FFPS program.
Yeah, so FFPSA is legislation and is the guide for states to develop their prevention plans should they determine to opt in. FFPS is California's program in response to FFPSA, and it includes the block grant dollars. So as Lori talked about sort of this shift to well-being, California has provided counties with dollars to build out their prevention systems to include primary prevention. And that's where we get to the well-being. So that's FFPS, Family First Prevention Services, different from the ACT FFPSA.
Thanks, Dana. So somebody then just put in a question about, is this toolkit best initiated by counties or CBOs? So that's an interesting question. I think the lead for the comprehensive prevention planning is most squarely with the county. However, like I said, policymaking without proximity does not work. So the CBOs, as we know, are the ones that are going to be most relied upon to help provide the kind of supports and services that we're going to take us on that road to well-being. So to the extent that your CBOs can utilize this toolkit to do their messaging to their constituencies, I think is great. And so I think it's something that you're doing in partnership.
You want to make sure that you're not sending mixed messages, right? So the importance of CBOs and counties putting forth the same message is critical, and so that partnership is really important.
And then Hector asked, will we receive the webinar for future? I think that's a Caltrin question. I think yes, the recording will be available. And thank you all very much. I was really happy to be able to do this with you all, and I really hope you give some feedback so we can make sure that we are effectively communicating and giving you the tips and tools that you need to help realize this well-being vision. I know that's what we all want.
Lori and Beth, thank you again. And everyone who joined us today, we do also hope that you will join us on February 1st, which is the first learning forum for the 2023 Child, Family, and Community Wellbeing Learning Series. The topic of that learning forum will be equity as context for the journey and attacking disproportionality head on. So we hope that you will join us then. And do look in your email inboxes in the next 2 days for, as we mentioned, the recording and the link to the toolkit. Thanks for joining us, everyone.